third client is more of an acute situation.
Mhm.
She's 55. She recently had COVID. She tested positive for 11 days. She's
Okay.
now testing negative, has been negative for about almost 10 days now.
Okay.
She's a voice artist, and her voice is currently dry and scratchy and has been for most of probably the last 15 to 20 days. And I saw her earlier today, and her voice was definitely dry and scratchy. We did the first part of the regenerating the immune system. So
Mhm.
like the beginning of the lymphatic stuff.
Mhm.
And her voice changed dramatically in an hour and 15 minutes.
Oh,
But
tremendous.
to me, that would be like carry on with more of the lymphatic stuff, but I'm sure
I would probably do that. Like, so if she's responding already with lymphatic work, I mean, you know, any time you detoxify the body, it's a good thing. Sometimes it's a little slow to reduce some of the symptoms, but in this case, if she's already starting to have some symptoms reduce, that's great. A couple of things that I would add, and I would do them kind of in this order. One is you could have her inhale a few times a day. You know, she could even do more if she wanted, but at least like 2 or 3 times a day, like cinnamon or cassia. And the issue is like it will help strengthen the body, but cinnamon especially is an overall body stimulant, and it helps to like generate moisture in the mucous membranes. It helps to moisturize the eyes. It helps to, you know, just get stuff moving in the body. Like it just makes everything start moving and stimulate everything. And I think sometimes with these post-COVID issues is some of the body has become a bit stagnant and isn't quite functioning up to par, up to speed. And in the old days, we used to give them like this is a long time ago. I would give them like big dosages of cayenne pepper, like you know the tincture. It's not a comfortable process, but it does work. The easier version is just to sit and inhale cinnamon, like you know it
okay.
works almost as well without the burning throat and the burning gut. You know, the cayenne pepper is a little bit hard on the throat and the gut. But if you have her inhale that for a period of time, within a couple of days, that should improve. Then if she's still kind of a little sluggish in that area, I'd go to the Shazandra. You know, Shazandra helps to moisten the mucous membranes from like kind of the inside out. It helps the body like convert water to something that's usable. Like sometimes we take in a bunch of water, but because of what's going on in the body, it just kind of passes through the body or gets dumped into tissue and it's not getting properly utilized. And the Shazandra helps with that conversion, so it helps to moisten everything. I suspect the cinnamon is probably going to be the thing that helps. You know, between that and the lymphatic work, that should help to knock it out. But if she still needs a little something, you know, it's very fortifying. It will help her with her sleep and help to moisten the mucous membranes.
Okay. So just to confirm on the cinnamon cassia, not in the evening because it's too stimulating.
Yeah, probably not a couple hours before sleep. Like, you
Okay.
know, if it was like 5 or 6 o'clock, she could kind of still do it, but I would do it morning, afternoon, late afternoon, and then in the evening, just let the body be tired and go to bed.
Okay. And on the Shazandra, 2 drops internal.
Yeah.
Okay.
Yeah.
Cool.
And if she
Thank
did
you.
that right before bed, it would help her sleep.
Okay. Good time. Okay. Wonderful. That's awesome. Thank you very much, Greg.
Yes, yes, yeah, good.